This adult man presented with nausea and vomiting and diffuse abdominal distension. A CT scan was done, and the CT scan shows this is the axial contrast enhanced CT, and these are the coronal reformats. As we can see, this is the stomach, which is diffusely distended, containing layering intraluminal fluid with transition point at the level of duodenum here. And on the coronal images also, we can see there's narrowing at the level of duodenum right here. Small bowel loops otherwise are normal in caliber. There is no evidence of obstruction. We incidentally noticed some gallstones there in the gallbladder lumen. And so there was concern for any obstructing stricture or a mass lesion at the level of duodenum based on this initial CT scan. The patient underwent an MRI, and these are the MRI images here, axial T2 weighted image, and this is coronal T2 weighted image. And as we can see here, there is this diffuse wall thickening as we saw on the prior CT at the level of the first part of duodenum. And here also on the coronal T2 weighted images, we see there's this wall thickening involving the first part of the duodenum. There has been placement of an nasogastric tube, as we can see here, that has resulted in decompression of the stomach since the prior CT. And if you look closely and zoom in at this level where we saw this wall thickening, we do see there's this cystic area, multicystic area, multiple tiny T2 hyperintense foci which are involving the wall of the first part of duodenum. And the same, we can see there's the circumferential wall thickening of the duodenum, predominantly made up of the cystic wall thickening. So it appears there are these multiple cysts, which are annular in arrangement, involving the wall of the duodenum and likely causing this obstruction. So evaluate this further. We look at the contrast enhanced sequences and restricted diffusion. So we do see there is this area of the duodenum which is involved. There's mild enhancement, but there is no discrete nodular enhancing mass at that level. And that cystic area which we saw on the T2 weighted images does not show any internal enhancement to suspect any mass lesion. And now if we look at the DWI weighted images right here, there is no hyperintense signal to suggest restricted diffusion that would suggest any malignant etiology. So there are no suspicious features on contrast enhanced sequences and DWI weighted sequences. And on T2 weighted sequences, we see a multicystic area which is annular and causing wall thickening of the duodenum. So putting all these findings together, the findings were suggestive of a benign etiology and likely Brunner cell hyperplasia, Brunner gland hyperplasia, and the patient underwent an endoscopic biopsy, and the findings were consistent with a Brunner gland hyperplasia of the duodenum that caused this local mass effect, which resulted in dilatation of the stomach secondary to gastric outlet obstruction. Thank you.